Will Medicare cover your cancer treatment? The answer may surprise you, but hopefully will save you from some large medical bills. Really, at the end of the day, receiving a cancer diagnosis is one of the worst pieces of news that you can receive. So, our goal today is just to kind of walk you through what this would look like based on your Medicare plan, because it's not something I want people to have to worry about in that time of need. So, to kind of dive on in here, the cancer treatments that Medicare covers are sort of everything in general. The chemotherapy, radiation, whether you need surgery or various screenings, preventative or ongoing screenings, tests, therapies, if you have stay at medical facilities, if unfortunately eventually you need hospice care. These are all things that are included in Medicare, but what we really are going to talk about today is how they're covered under different types of Medicare plans. So let's go ahead and start with how Medicare would cover chemo. So as you know, chemo is generally one of the most popular forms of cancer treatments. And typically it is an oral chemo or an intravenous chemo. So either, you would take the medicine orally or through the vein. And the way that we've set this up is just to kind of give you a sense as to what you would pay. So if it's medically necessary, we would either do it at the doctor's office or at a chemo clinic. Your Part B deductible is $257 for 2025. That number changes slightly every year. We've seen it increase, a few dollars each year. We have several other videos talking about those dollar amounts. So to kind of start, if you're on just original Medicare, now as a reminder, original Medicare would be your red, white, and blue Medicare card. There are deductibles, copays for things. And then in general, Medicare pays 80%, you pay 20%. So you would pay that $257 deductible, and then you would pay 20% of the remaining costs for your chemotherapy. The thing about original Medicare is there is no maximum out of pocket or no ceiling on your expenses. So you really kind of are sort of at the liberty as to what that 20% adds up to. Now, if you're on a Medicare supplement, it works a little different here. Most supplements now you are going to pay that Part B deductible, that $257. And, typically most supplements then would pick up the 20%. Obviously this is medically necessary for you. So, most of the time Medicare supplements cover anything medically necessary and approved by Medicare. So they would generally kick in and pick up the remaining 20%. Medicare Advantage plans work differently. Most of these plans would waive this $257 deductible, so you're not going to be paying that. Most of these plans do have copays, coinsurance, and out-of-pocket maxes for everything you do throughout the year. So you really have to look at your specific plan to see, what would the cost? Is it a percentage? Is it a flat dollar amount? What does that actually look like for each Medicare Advantage plan out there? Now, the good news is, unlike with original Medicare, on these plans, there is an out-of-pocket maximum for them, so you do know your worst-case scenario for the year going in. Now, a lot of chemotherapy is also pills that you take orally, and a lot of those would then fall under the Part D Medicare, the Part D prescription drug plans. So a lot of these are pills that you would take at home, whether it is actually the chemotherapy or the anti-nausea drugs or the pain medication to go ahead and help you through this process of treatment. So, the thing that I want you to keep in mind here is with original Medicare, or if you're on a Medicare supplement, you do need to purchase that Medicare Part D plan on its own to either pair with original Medicare or to pair with your Medicare supplement. So you have to kind of have that standalone Part D drug plan. With a Medicare Advantage plan, most of these include the Part D drugs in with your health insurance. So it's just one plan for everything. It's very important every year that you check your formulary for your Part D drug plan to make sure that any prescriptions that you're taking are covered by it. If you're prescribed something throughout the year that's not covered on the formulary, there are a lot of steps and different processes that you can take to ensure that you'll still be able to take the prescriptions that you need. But going into each year, I would highly recommend you check your formulary. All right, switching gears now to radiation, which, a lot of people pair radiation with chemo for cancer treatments. A lot of people just do radiation or chemo independently. So for radiation, we've had clients that do it inpatient or outpatient, so in the hospital or out of the hospital. And, just a quick reminder on the hospital side of things. If you are inpatient in the hospital each year, you're going to pay a deductible of $1,676. Now, the important thing, and we have several videos on all of these dollar amounts and whatnot, But I do think it's always important to mention this. If you're just on original Medicare and you're in the hospital in a 60-day period, and let's say you're out then for a while and you go back in, this deductible is not annual, it's per benefit period of 60 days. So this could potentially, you're in the hospital in January, you're out, you go back in April, you're out, you go back in August. You could theoretically pay this multiple times throughout the year. So obviously this adds up very quickly. Now, outpatient radiation, on the other hand, this is generally covered by Part B because it is outpatient. And, if you don't have a supplement or a Medicare Advantage plan, you're going to be paying 20% of the cost just on original Medicare. If you're on a supplement, that 20% will be picked up depending upon which supplement you're on. On average, we see all of that would be picked up as long as it's medically necessary. And on a Medicare Advantage plan, that would really vary depending upon which plan you're on. But the most important thing on the Medicare Advantage plan is if you are in a network-based, an HMO where you have to go see in-network providers, ensure that all of your cancer providers are in-network. One of the perks of Medicare Advantage plans is you can change between them every single year. So if unfortunately you're diagnosed with something in the fall, ensure that the providers you want to see next year while you're going through your treatments are included in the network and the plan that you're looking for the following year. That's a really important element when going through all of this. You just don't want to have to worry about where you can go and where you can't. So go ahead and check out all your options every fall. So the last category of treatment that we really see a lot is obviously cancer surgery, whether it's removing the cancer from you or what they're doing to ensure that you're going to continue to fight this disease. When it comes to cancer surgery, whether you're doing an inpatient and outpatient, it pretty much aligns with everything that we've just talked about. You have the Part A deductible, the 20% after those deductibles, et cetera. So this is pretty much in line with what we've talked about with everything else. But the good news is when it comes to it, obviously, if you have to have surgery due to a cancer diagnosis, it's going to be medically necessary and it will be covered by Medicare. It just depends on what type of plan you're on with your Medicare to see how much is covered. So as we start to wrap up, there are a few things that I want you to keep in mind as moving forward. Frankly, I hope none of this ever applies to you because I hope that none of you are ever diagnosed with any type of cancer. But in the event that you are, first of all, I'm horribly sorry that you're going through this experience, but these are some things that I want you to keep in mind while you are. So, specialized cancer centers and doctors. So there are, as we talked about, there are networks with Medicare Advantage plans. Frankly, I'll be honest with you, a lot of Medicare Advantage plans include hospitals that maybe aren't even in your city or your area. So, we're located in Cincinnati right now. Well, maybe you want to go up to Cleveland or different areas for treatments. Really check out the options and the networks on these plans because a lot of these plans include facilities in different areas. So that is an option available to you. Supplements, as long as they accept Medicare, they will accept your supplement. So you should have a little more flexibility when it comes to networks. Second, prior authorization. The doctor needs to get pre-approval from Medicare sometimes. This could be time consuming. It could delay care. It is just a fact of a lot of insurance. So it's worth being aware whether your plan includes that. The third is the out-of-pocket costs. These can be significant. If you're on original Medicare, as I talked about earlier, there is no ceiling to those out-of-pocket costs. On Medicare Advantage plans, these do have an out-of-pocket max every year. So you sort of go into the year knowing what your worst case scenario is. The coverage change, as I talked about earlier, you can change your Medicare Advantage or your Part D prescription drug plans every fall during the annual enrollment period between October 15th and December 7th for 1/1 and the entire year of the next year. So check your annual notification of change, what the insurance company will send you each year to make sure that the way that your plan is covering you now, you're comfortable with, and it'll still continue to cover you for the next year. One additional thing to mention here too is if you are on just original Medicare and the fall is rolling around and unfortunately you're diagnosed with something, you could pick up a Medicare Advantage plan just to ensure that you have that out-of-pocket max and sort of know your worst case cost scenario going in. So wrapping it up here, again, I hope this is something none of you ever have to experience, but if you do, really be aware of any networks your plan has associated with it, those out-of-pocket costs. And really at the end of the day, if you have questions or you're uncertain or you're confused as to what's going on, just give us a call. We're here to help. We will help you in any way that we possibly can. And again, I just hope this is something that you don't have to experience.